I can ask you a question. So since you
Yeah.
are talking about, many mutations, can it happen that the patient has all the 5 mutations we've talked about today? And what does the patient do in that situation?
So yeah, I mean, so if you see multiple mutations, you mean?
Yeah, like a patient can we see a patient who has an EGFR, ALK, ROS, NTRK, KRAS in the same tumor?
Yeah, so it's a great question. It's very rare. So we feel that many of these mutations are mutually exclusive of one another, though we do sometimes see that. Those are the perfect cases to be presenting at many of these academic institutions will have molecular tumor boards, because we're all still learning and gaining information and trying to work with our pathology colleagues to make sense of some of these results. And when you do see true, I mean, we've had some patients who've had EGFR and ALK or EGFR and KRAS, and what do you do with that? And really coming up with a consensus amongst your group, what would offer the patient the best, chance at a response. And I don't think we have all the data really. I mean, I think as we're getting more and more results back from these NGS panels, I think it's we're learning more and more about individual tumor types and why patients may have certain mutations, driver mutations. We're seeing a lot of these VUSs or variants of unknown significance. Those are also coming up in the reports, maybe present at kind of a lower copy number compared to the other mutations. And so what do you make of that? I think that's really an area of active research right now. When we see these co-mutations, sometimes we're actually worried that they may predict not as good responses to certain therapies. A great example is when we see STK11, for example. It's oftentimes on a patient's report. There's been increasing data to suggest that patients who have STK11 don't have as good response to the immunotherapy drugs. And so does that mean that you're not going to offer a patient immunotherapy? I don't think that we're quite there yet. I think, it certainly makes us a little bit nervous, but we're still trying to understand and trying to get a better sense of what these VUSs are, why we see them co-occurring with certain mutations, and what that might mean clinically for the patient. So I think, hopefully we'll continue to gain a better understanding of this over the next several years.